Everyone, and welcome to this audio podcast. This is audio podcast under the Storm Labostix production. This is the Shientist with an audio podcast as part of the Labostix Intermission. And here I thought I'd provide an overview in regards to a focus around bridging gaps between nephrology practice. Now, this works before anything else. Has a collaborative aspect with the Renal Patient Support Group, the RPSG, and the Kidney Disease Renal Support Group, or KDARS for kids. And the works highlighted here is works that the RPSG team had been nominated in and around works with the under the Royal Society of Medicine, or the RSM, and here I've been sort of given this opportunity. I wanted to take this opportunity to highlight the works sort of from a collaborative perspective with the RPSG, and where the RPSG have overall sort of credit around this works. So this works again is from a collaborative perspective, and I hope that anyone listening in on this audio podcast can sort of take anyone listening in on this audio podcast, feel free to check out the works around this through the Renal Patient Support Group, the RPSG, overall. Thank you, and enjoy this podcast. And so, a bit of introduction. The provision of appropriate educational support and interventions can improve healthcare, but there are also disparities between patients who are self-motivated to navigate elements of healthcare and those who seek out information but have little desire to becoming self-empowered. Patient education is identified as an essential tool to use wherein patients become sort of more autonomous surrounding health and disease. So educational initiatives help people with long-term conditions or long-standing conditions to develop skills and confidence to manage intricate systems. In some research, a survey was conducted where 353 people with long-standing condition or long-term conditions, it was reported that support is most sought from health professionals, and then websites, and then family or friends. And then education is as part of this intro. Education is also important because in context of chronic kidney disease, CKD is irreversible, and patients may need to be aware of disease and life cause, but therefore education should also be timely, accurate, and patient-centric or person-centered accordingly. So, what were the aims and objectives of this work? So, first of all, in line to chronic kidney disease stages, in context of primary care more specifically. So now in context of secondary care, patients with chronic kidney. Now into the sort of crux of this, and so I'm not going to delve into a little bit around the methodology around. So in and around some of the findings, and so in conclusion, access to so in summary, education and information should be